Why did this domestic production and supply take so long? Is it also a signal that the international shipments of the other vaccines, Moderna and Pfizer, are in jeopardy due to the EU's new export control measures? Let's find out. Joining me now is the Minister of Innovation, Science and Industry, Francois-Philippe Champagne. Minister, always a pleasure to have you on the program. Look, let's start with this announcement. The Prime Minister said this was going to be up and running by the summer. And like an hour later, you contradicted him and said, no, it won't be up and running until the end of the year. Why the discrepancy?
Well, let me be first. I'm happy to be, thank you for the invitation. So let's be very clear. It's very, very simple. When you build a plant, there's three phases. There's a construction phase, certification phase, and production phase. So construction will be completed by the end of the summer. Then we have what they call good manufacturing practices, which is a Health Canada certification for any biomanufacturing facilities in Canada, and then we'll move to production. So what I said is that by the end of the year, we expect to be able to manufacture the vaccine, the Novavax vaccine in Canada. But let's be clear, this is separate from the purchasing contract that we have with Novavax for 52 million doses. This is about resilience. This is about building the pillar to make sure whatever comes next, Canadians, those who are watching, would expect their government to make sure that we build the resiliency to face any other health emergencies that we may face in the future.
Okay, let me pick up. First of all, the Prime Minister said we will be producing vaccine reasonably quickly after that. Now it's the end of the year, it's not the summer. That's not clearly reasonably quickly, but let's talk about that expectation. The NRC facility where the Novavax is going to be produced, that facility was supposed to be producing things last November, okay? This was, your government invested money in that facility. I have the press release. It was supposed to be producing the CanSino vaccine. Didn't work. It's taken more than a year now to get it online. Why is it taking so long?
Well, those are two different things. Now, let me go back to your first question. What I said is that by the end of the year, because one thing that you cannot predict and I cannot predict is the time for the certification. Anyone who has certified a plant in their lives would tell you it can take from weeks to months. That's why I said construction the end of the summer, certification, which is an independent process by Health Canada, could be weeks or months. So by the end of the year, we would be in a position, but that time in between for certification can vary.
I understand that, but let's go back. But I'm just talking about last May 2020, the Prime Minister promised this facility would be producing and distributing vaccine. It didn't happen. I know the partnership with CanSino Biologics fell apart. But since then, nobody's taken over this facility. It's been delayed. On May 12, 2020, the NRC announced its plans to work with CanSino. So since that time to what you're saying, another year, what has gone on? Why has it taken so long to kick up domestic supply?
What you're talking about was about clinical trial. So the 44 million was for clinical trial, small-scale production clinical trials. When we made the investment, the 126 million was to build a line, to build the facilities who could produce millions of doses per month. The good news today is that Novavax chose Canada. They could go anywhere. I spoke to the CEO. They produce in about 7 or 8 countries in the world. They chose Canada. Why? The reason, they said, listen, very simple. The manufacturing facility and the type of manufacturing plant is compatible with their vaccine. The speed at which we can do it, and the fact that Canada has demonstrated to be very stable, predictable.
But the speed, and I look at, it's good news, Minister. Everybody wants us to have a domestic supply, but that's been the political question for 10 months. Let's just be clear. Once this facility is producing Novavax, it'll not be helpful for this current pandemic, right? This is for a future variant or something else, because your government's promise that other vaccines, everybody will be vaccinated before this is actually online, right? So this is for the future, not now. Isn't that fair?
Yeah, well, to your point, I think that no one can predict exactly what the future is going to be. And that's why I think we need to be prudent. But let me rephrase a bit what you were saying. We made, the World Health Organization declared a pandemic in March 11. In March 23rd, the Prime Minister announced other pillars of our resiliency. Medicago in Quebec City, 173 million to build a manufacturing facility, a state-of-the-art facility. Invest as well in Vido in Saskatchewan, another plan to make sure that we'd be resilient, and Accelera in Vancouver, when we invested over 100 million. This has been like an Apollo project. When the pandemic happened, we scouted the country. And you know that biomanufacturing has been leaving this country since, it started in 1980s. There's different reasons, different governments, different supply chain. Well, we entered this pandemic with a very low base when it comes to domestic scale manufacturing. So what did we do? We look at the most promising candidates. We invested to make sure we take strategic investment with a long-term vision. And Novavax is just complementing the foundations that
Minister, those are listen, I appreciate that, but I got to contradict you. Sir John Bell, the Canadian and the Regis Professor at Oxford, who was on Question Period on Sunday, who is responsible for overseeing the development of the Oxford AstraZeneca COVID-19 vaccine that is licensed in at least 13 countries, not Canada, told our audience that Britain scaled up its domestic vaccine production from, I'm quoting him, from near zero capacity in the last 10 months. They have it now. He said that countries like Canada made a strategically bad decision not to do it. We didn't license AstraZeneca. We could have produced that vaccine, and we didn't, sir. So now you're saying, okay, we better get a domestic production up. We finally signed on with Novavax. Was it a mistake not to sign up with AstraZeneca 10 months ago, like the UK did, and that's why they're way ahead of us?
Let me debunk that. And I would say we took advice from science and our leading experts in Canada. I have all the respect for him, but I can assure you we did not start with the same manufacturing base. The scale of the manufacturing capability in the UK when the pandemic started was not the same as the one in Canada.
He said it was zero. I'm just saying, look, we have Sanofi, we have GlaxoSmithKline.
The Canadian market said, Minister, that when you look at the domestic scale, I'm not saying by the number, but in terms of scale, we didn't start at the same place. But the good thing, and I spoke to the chairman of AstraZeneca, so I am very familiar with these things. I spoke to him about 5 times already. So we are today, and I would say with the different pillars we have put, in one of the best positions to be resilient for whatever may come next. Whatever is the next health emergencies, I hope that today people will see the investment we make today will protect the lives and will protect the health and safety of Canadians.
And that's good news. My question is, look, in the middle of, listen, we may be protected from the next fire, but we're burning up in this fire. And that's, I think, what the politics is. We've got a dearth of vaccines available now. I know they're coming. But on that note, because let's talk about the now, not the future, Canada was not on the EU's exemption list, the written list, for the export controls that could potentially disrupt our supply. It may not, but it could potentially. Can you explain why Canada, which got verbal exemptions, I understand the verbal ones, not written? Why wasn't Canada on that exemption list so we can have confidence that our supply will not be disrupted?
Well, we got verbal assurance. To your point, Evan, I think that's why the investment of today are so relevant, I would say. But to your point, the Prime Minister has been engaged, colleagues have been engaged with their respective colleagues in the European Union. We receive assurance. The latest information that I heard was that the shipments were on their way. So the verbal assurance that we received have been materializing. That's the latest information, at least that I've been able to access. And the reality, Evan, is that these assurances, in addition to what we're doing, because let me be clear also for the viewers, what we're talking today about manufacturing does not change about the plan to vaccinate everyone in Canada by September. This is in addition to. No one is pretending that what we're doing today, but I think everyone watching would hope and say, I
understand that, but you're a lawyer. Let me talk to you.
Come in the next few months.
Let me talk to you as a minister, but you're also a lawyer. Contracts matter. If you were making a contract for a supply, you'd get it in writing. We've got a verbal assurance. That's great. Better than nothing. But then the EU put out a list of countries that were exempt from these potential export controls. Canada was not on them. There's a gap between someone saying, don't worry, everything's good, and saying, okay, well, if it's so good, will we get it in writing? And again, what's the explanation? If this is an ironclad verbal guarantee, it is a giant glaring miss that it's not on the published list, wouldn't you say?
Well, I would say the verbal assurance that we receive are working, because the simple answer to your question is I understand the shipments are on their way. So the verbal assurance we have received are working. And let's be clear, Evan, you know, we've been working. I mean, I was the Foreign Affairs Minister not too long ago. We've been working with our colleagues in the EU. You remember at the time when we were working about supply chain, air bridges, transit, we've been working hand in hand. I mean, you know, that's why, in a way, that Canada also has been able to attract Novavax. I think we have demonstrated over time not only that we have the qualified labor, but the stability and predictability that we provide.
I know, but that's not. Look, we have a great relationship. They've got domestic pressure, though. I mean, I just got to ask you: will we get it in writing? Let's be fair. We just want the exemption. We hope we're exempt. We hope our supply is not disrupted. There is a list. Wouldn't Canada want to have put this in writing? That makes it an ironclad. Because what's the guarantee that domestic pressure in Europe won't make them change it and say we're going to snatch more of Canada's supplies? After all, our supplies have been lower on both Moderna and Pfizer than we were reassured in the first place verbally. So will we get it in writing?
Well, the situation as we speak now is that we have verbal assurance, shipments are on their way, and I'm sure colleagues will continue these discussions with their counterpart. But that's why at the same time, Evan, and that's the real thing today, is that we need, and everything you just said to me just confirmed why we need to be more resilient, why we need to expand the supply chain in Canada, why we need to accelerate these discussions and make sure that we have as much of the components of the vaccines from end to finish, from fill to finish, from adjuvants, everything that we can do, as much as we can do in Canada. That's the way to protect the health and safety of Canadians for decades to come.
Well, listen, we got to do it in the future, but obviously there's the fierce urgency of the now. Minister Champagne, I do have to leave it there. Always a pleasure, sir, to have you on the program.
Thanks for inviting me. Always a pleasure.